and for today's video, I want to demonstrate how to check a blood pressure manually. But before that, let me ask you, what is blood pressure? Blood pressure is the force of your blood pushing against the walls of your arteries. Each time your heart beats, it pumps blood into the arteries. So, let's proceed. First, you will need to perform hand hygiene, wear a gloves, and gather your supplies. You will need a stethoscope and a manual blood pressure cuff. Make sure that you familiarize the parts of the sphygmomanometer, which composed of a bladder length, bladder width, and a cuff. An inflatable rubber bladder that is fastened around the arm, and also the tube, inflation bulb, valve, pressure gauge holder, and a stethoscope. To begin with, let us make sure that our patient is sitting down and let him rest for about 5 to 10 minutes. Why is it the patient should rest before taking blood pressure? The hypothesis is that the resting time before the blood pressure measurement should be longer than 5 minutes to reach the stabilization of the blood pressure in the patients. Confirming this hypothesis could have an important implication regarding hypertension screening. Now, let's measure a blood pressure manually. The arm of the patient should be at the heart level, and their legs are uncrossed. Then what we're going to do is we are going to get our stethoscope and our blood pressure cuff. And make sure you get the right size cuff for your patient arm. Because if you use too big of a cuff or too small, can throw off the reading. And what we're going to do is we're gonna palpate the bronchial artery, because this is the artery we're gonna be listening to. To get our blood pressure, because we're going to be getting our systolic number, which is the top number, and this is the first sound we hear. And then our diastolic number, which is the bottom number, and this is the point where we no longer hear the sound. So, whenever we're looking at the gauge of our blood pressure cuff, we want to make sure we're really noting those points, because it's gonna tell us our systolic and diastolic number. So, what we're going to do is we're going to put our cuff to our patient. And we want to make sure we find the bronchial artery. This is the artery we palpate that we'll be using to determine our blood pressure, and it's found on the bend of the arm. We're going to find it by pressing our index and middle finger slightly, and it is located here. So we're going to look on our cuff, and our cuff has the arrows. And because this is the left arm, we are going to make sure that this arrow is pointing in the direction of where that artery is. So, you're gonna put the cuff up above 2 inches above the bend of the arm. First, what we want to do is we want to estimate the systolic pressure. So, we want to find that number. To do that, we're going to palpate the bronchial artery, and we're going to inflate the cuff until I no longer feel the bronchial artery and point. When I no longer feel it, I need to make sure I'm looking at this gauge to know that number, because that number is our estimated systolic pressure number. Then, when I go to take the blood pressure, I'm going to inflate the cuff 30 millimeters of mercury, more than the estimated number. Now, the whole reason for doing that is because we want to avoid missing the auscultate gap that can occur in some patients. On all patients have it, but some, it's usually patients with hypertension. Because the oscillatory gap is like this abnormal silence that can occur, and it will throw off whenever you actually hear that first sound, which is your systolic number. So, I'm inflating the cuff by feeling on the artery, and I'm going to note the point where I no longer feel the artery, which is about at the 100. Then I'm going to deflate it completely and wait about 30 to 60 seconds. And then we'll take the blood pressure, so our estimated systolic number is 100 now. And I'm going to inflate the cuff to 130, and that will avoid missing oscillatory gap if one was present. So, I'm going to take my stethoscope, put it in my ears. You can use the bell or the diaphragm. And I like to use the diaphragm. So, we're going to place that over the bronchial artery. So, do it lightly. Don't full compress it because you can include the artery. Then, we're going to inflate our cuff to 130 millimeters of mercury. And we're going to let it fall for 2 millimeters of mercury per second. And we're listening for the first sound of our systolic number. And we're now listening to our last sound. It was 60. So, the blood pressure is 100/60. Then, once you have your reading, make sure you fully deflate the cuff full of air. And you're going to take the cuff off of your patient, of course, and clean it if it is not disposable. And you will document the blood pressure and what arm you took it. Now, normal blood pressure readings according to the American College of Cardiology 2017 updated guidelines, a normal blood pressure is a systolic less than 120 and diastolic less than 80. While elevated blood pressure would be considered a systolic of 120 to 129 and diastolic of less than 80. Hypertension stage 1 would be a systolic of 130 to 139 or a diastolic of 80 to 89. And hypertension stage 2 would be a systolic greater than 140 and diastolic greater than 90. So, that is how to check a blood pressure manually.